Hey, this is Dr. Paul Firnhaber here at Lincoln Disc and Nutrition. And today, on this Wednesday version of 10 Minutes of Truth, I want to talk about inflammation and what it is. We hear a lot about that in our culture, about low-grade inflammation, how inflammation is bad for you. But what exactly is inflammation? So, a long-term, low-grade inflammation is a chronic systemic condition where the immune system is persistently activated at a low level. Now, our immune system is always on the alert in our body, always looking for things, always checking for things to make sure there's nothing they need to deal with. But long-term inflammation is where the immune system is consistently activated. And what happens is that slowly damages tissues and organs over a period of time. And long-term low-grade inflammation is linked to a lot of chronic conditions, which we'll talk about a little bit later. So what happens during long-term inflammation? Well, what happens is the immune system continually releases small amounts of pro-inflammatory chemicals called cytokines. And cytokines are like the alphabet or the language of the immune system. And some of the names of cytokines you may recognize, like interleukin-6, tumor necrosis factor alpha, and C-reactive protein, which is a common blood test that we use to measure inflammation. So what happens is cytokines make blood vessels leaky. And out of these blood vessels leak things like white blood cells, which get to the site of damage. They also cause swelling, redness, and heat, which are some of the hallmarks of inflammation. And you don't want to have this on a low-grade long-term level because over time it really damages tissue a lot. So white blood cells and other immune cells remain slightly activated even when there's no infection or injury. Another factor or another consequence of long-term inflammation is oxidative stress, where tissues are damaged biochemically because you have uneven electromagnetic charges with the molecules in the tissue. And so you have tissue that's damaged over time. So what are the causes of long-term low-grade inflammation? What are some of the things in the body that contribute to this or cause this? Well, there's several things. Number one is obesity, especially when there's visceral fat or fat around the visceral organs, which promotes or produces the inflammatory cytokines that I just talked about. A poor diet, refined sugar, processed foods, trans fats, which you find in most processed foods, almost all processed foods, a sedentary lifestyle, chronic stress that's uncontrolled or that's not managed well, disturbed sleep, chronic inability to sleep, environmental toxicity, which is a huge factor in our culture. And I just did a toxicity test on myself and found out that there's some things that I need to get rid of. And last but not least, infections or gut dysbiosis. So an imbalanced gut microbiome or the bacteria in the gut are not in balance. And that's caused by chronic stress and poor diet. Okay, so a bad diet, pharmaceuticals, those things cause your gut to be out of balance. So why is this such a big deal? Why is inflammation? Why are we talking about it so much? Because it's the driver behind a lot of chronic illnesses in our culture. Cardiovascular disease, type 2 diabetes, neurodegenerative diseases like Alzheimer's, cancer, autoimmune disease, and mood disorders like depression or anxiety. How do we reduce chronic inflammation? Well, number one is diet. A Mediterranean diet, veggies, fruits, omega-3 fatty acids, fresh wild-caught fish like salmon, sardines, things like that. Regular physical activity. So exercise is really important. Managing stress. You can do that through breathing exercises, meditation, maybe some therapy. Sleep, getting 7 to 9 hours of quality rest. Quitting smoking and alcohol in excess. Both of those things cause lots of oxidative stress in the body and inflammation. And improving gut health. So how do you do that? Well, eating a lot of fermentable fiber like, grapefruit juice pulp, grapefruit, avocado, broccoli, asparagus, lots of fruits and vegetables are very, very good for. Apples are very good for creating and feeding your gut. Okay, and so that's really, really important. So if you have chronic stress or chronic inflammation, and you know that, and it can be measured, like I said, with a simple blood test can tell you what your inflammation levels are, then you need to work on it. Now, there's some supplements that can really help with inflammation. So taking like fish oil, omega-3 fish oil, curcumin, turmeric, boswellia, which are herbal supplements, which are really good, can be of enormous help to inflammation. Getting your adrenal glands functioning properly with specific adrenal nutrition can help with inflammation. Just exercising regularly is a great way to reduce inflammation. And so this issue is an enormous problem in our culture. And you can walk around a grocery store or a mall and kind of pick out the people that are inflamed. And, they're walking, basically, in some regards, are walking time bombs because that inflammation is going to catch up with them eventually. So I would recommend that if you're wondering whether you have low-grade inflammation, you get tested. And one of the things that causes low-grade inflammation is that most people don't even realize they have is toxicity. Toxic chemicals they're exposed to, molds they're exposed to, heavy metals they may be exposed to. And those things can be tested with one test, and you can find that out. But if you just want to know, do you have inflammation? That's a simple, fairly inexpensive blood test that we can do at the office, or anybody can do. But I just want I want to make you aware of how important this subject is and the things that you can do just to help yourselves. So that's all I'm going to talk about today. If you have any more questions about this, I do health talks every other Tuesday night. This week from last night or next Tuesday, I'm doing one on how to care for yourself for a lifetime. And we're going to be talking about some of these issues there. And you can ask questions at those talks. So those are opportunities to come interact with me, dialogue with me about these very issues, and I can answer some of your questions and get some of those, any confusion taken care of. So you're always welcome in my talks. They're at 6:30 every other Tuesday. They last a half an hour, and they're at no charge. We do it at our expense. So hopefully I'll see you at a few of my talks. If not, you want to get checked for inflammation, just call my office at 488-2220, 488-2220. We'll be glad to help you out. Otherwise, we'll see you next week with another edition of 10 Minutes of Truth.